Right, so in today's video, what we're going to run through is talking a little bit about the disc anatomy and how disc herniations occur, so the specific mechanism with that. Now, I've got my trusty dynamic disc design models here that we'll use to actually visualize these, and it's very relevant to understand how they occur, the mechanisms, because it also guides what you need to do for the treatment and rehabilitation of lower back disorders. So firstly, starting off with the discs. So the discs themselves are made up of two parts. We've got the outside covering, which is called the annulus, or annulus fibrosus, and in the middle is the gel center. Now the annulus fibrosus on the outside is made up of collagen fibers that are woven together. So if you imagine a shirt, we've got a lot of fibers that are woven together, and we've got roughly about 19 to 20 of these rings in the lumbar spine of those discs on the outside. Now their job is to contain or keep the gel nicely centered in the middle through here. So as you can see, that gray part there, the gel, nice in the middle through there. Now, under normal circumstances where the disc is healthy and uninjured, under load, it acts almost a bit like an airbag and allows us to bend and move. And the outside fibers contain or keep that gel in the center. Now, what happens or how disc injuries occur is from repetitive, what we call stress-strain reversals. So stress-strain reversals being something like bending over forward and then coming back up repetitively. So if we take a look at this spinal model here, if we're flexing and extending that spine repetitively, under load in particular, what happens is that stress accumulations build up in the disc, right? And this happens with the disc fibers. And slowly what happens is they start to delaminate, right? So they start to come apart. That delamination will form a little gap where the gel under pressure can start to seep its way through. So if I show you this one here, if I come nice and close, this disc there, the outside fibers, and we've got that red part in the delamination at the back through there. If I put a bit of pressure onto that gel nucleus, as you can see, it starts to pressurize and make its way backwards. Okay, so that's how a delamination occurs and how disc injuries start. Then from there, what happens is, as they make their way further and further out backwards, we can end up developing a bit of a disc bulge like that. And in this case, what we classify as a flexion intolerant disc bulge. So when we add compression and then flex forward, as you can see, that gel starts to come out backwards. Okay, and that's because the gel in the center plus the disc itself has a lot of liquid in it, and therefore it acts hydraulically. Right? So if you're bending forward, it's going to pressurize backwards. I always like to explain it to patients, it's like a water balloon. Right? You've got a water balloon, you push on one side, the water gets pushed to the other side. It's the hydraulic nature of it. Same thing occurs in the discs, right? Because they've got gel and they've got a lot of water, that if we have those delaminations, when we put some load, aka gravity or carrying things, lifting things, and we put a little bit of flexion onto it, that hydraulic pressure is going to pressurize out backwards, and then that's where a disc bulge or eventually even a disc herniation can occur. Okay, now with those guys, when the disc herniations or disc injuries occur, we can actually have a change in the stability of the disc itself, and this can lead to different type of issues. So in this model here, this disc has just lost a little bit of stiffness. Again, if I come a little bit closer to you guys, you can see how that just moves a little bit more than it should, that level up top there, right? And this is what we call a little bit of shear instability of the lumbar spine. And that has occurred because those fibers that we spoke about have delaminated and they've lost their stiffness and stability. So then we can have a little bit of shear instability occur, and that itself can trigger off pain, but it also can cause more loading to the posterior structures on the back of the spine. So it all goes back to, again, how those disc fibers delaminate and the gel starts to weave itself through. Now the good news with this is that it can be rehabbed and can be fixed, which we'll discuss in our part 2 of these videos.